If you're a nursing student or preparing to take your NCLEX, then you need to know the ins and outs of the interprofessional team. This is my quick overview for the NCLEX. I'm going to move out of here in a minute so you can take a screenshot. What's the most important thing is that this team surrounds the client. Alright, so let's dive into everybody's roles. So the NCLEX RN expects that every registered nurse that is entering the field is able to prioritize safety, communicate and advocate for clients, coordinate care through delegation and supervision, educate and uphold ethical, legal, and cultural competencies. Now moving on to healthcare providers, or HCPs as commonly abbreviated on NCLEX, these individuals can diagnose and prescribe, perform medical procedures, and create treatment plans. Now you're also going to need to know the difference between a physical therapist and an occupational therapist. A physical therapist assesses the mobility, so they treat physical impairments by developing exercise and rehabilitation programs in order to optimize functional movements, where an occupational therapist assesses activities of daily living, such as regaining skills and adapting to the environment to optimize their quality of life. So a PT can help you regain physical strength, such as getting up out of a chair, and an OT can help you adjust to how can you feed yourself and take care of yourself at home after a CVA or a stroke. Now moving on to social workers, they assess the psychosocial needs. So this is supportive services such as transportation, financial needs, living arrangements, will they be going from a hospital to a long-term care facility, emotional support, and more. Now, speech therapists assess speech and communication, and something very important to know for the NCLEX is speech therapists help you assess the risk for aspiration. And lastly, we have the pharmacist who prepares, evaluates, and dispenses medications. They also ensure medication safety, making sure that there's no interactions. They're another line between the MD and the nurse before administration. Now, these are just a few of the highlighted professions within the interprofessional care team. There is an abundance of professions within this, but it's most important to know that we all surround the client, and our end goal is to optimize patient care and improve quality of life for every client. I hope you learned something from today. Follow for more.